Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
Brad,
Bob.
today we're going to talk about the 3 big lies that you may hear about arthritis of the shoulder, hip, and knee.
Lies, that's a powerful word, Bob.
It is. It's, you know, we are into veracity.
Ooh, that's a big word.
Yeah.
Anyways, but yeah, this arthritis thing can really become more than it is at times.
Right. People, they can blow it up to being more than it is.
Exactly.
And I think you take the wrong approach to it. And by the way, we're talking about osteoarthritis here, not rheumatoid arthritis.
Sure. Yep.
That's a whole different animal. That's more systemic and such like that.
Exactly.
By the way, before we go any further, Brad, we got a couple new viewers here, I see.
There you go. I see them too.
In case you are new to our channel, please take a second to subscribe to us. We have a subscription button here or here. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. And by the way, Brad, you should also like us on Facebook.
I think people like us on Facebook.
I think they do.
Yep.
But the reason you want to like us on Facebook is because we're always giving stuff away. And we are currently giving away an Art Tree acupressure mat and pillow. That's all this, Brad. I want to hold on to it.
Yeah, I'll hold on to that. So we're going to...
So all you have to do is go to onto our it's down below, and you can see the description of it. But you just fill out this form, and you'll be eligible for 1 of 5 of these that we're giving away. And you're also eligible then for a 20% discount.
There you go.
All right,
Can't
next.
go wrong. Let's go on with the
All right, let's
arthritis.
go with the lies. The first lie that we see, Brad, quite often is that they come in and they've had x-rays done, and they go, oh, it's really bad. My shoulder's really bad. My knee's really bad. I think I need surgery. The thing is, it doesn't always correlate with symptoms.
Right.
And I see this all the time. A person goes in and has 2 x-rays done of both knees, and the knee that hurts the most looks better on x-rays.
Yeah, exactly.
And that's usually the one they end up doing first, too, because that's the one that's hurting.
Sure.
So there's not a correlation. In other words, you might have an arthritic joint right now and not have pain.
And you not even know it.
Right. So don't panic when someone says, oh, you have arthritis and it's pretty bad in your knee or your shoulder. If you're not having that much pain, don't go and have surgery right away. You know, let's try some things first.
Right. Work some, range of motion, some strengthening.
And we're going to show you those.
Exactly. It has to be done appropriately and managed right so they have success.
The second big lie is that people automatically think that it is going to just keep getting worse. And I've saw a bunch of studies, Brad, that shows that yes, maybe half may get worse, 50 to 57% of symptoms may get worse, but in 25% it stayed the same.
Yep.
So like, again, you have a knee and you're going, God, it looks bad. My symptoms are fairly bad. But in 18% it actually improved.
With some preventative or some management.
Some management, and right. And so not necessarily assume it's just going to keep deteriorating, and it's going to get worse and worse.
Yeah, be optimistic.
Right. The third big lie is that you're told not to use it. And to be honest, Brad, when I did my training at the Mayo Clinic, and I remember reading a study at the time, they had these rabbits with arthritis. And believe it or not, they took these little rabbits, and one set of rabbits, they put them in immobilizers.
Kept the joint still.
Right. And the other one, they put them in a little machine that made the knee move.
Okay.
And the ones that the knee moved, actually the arthritis got better.
Okay.
Because you're getting that synovial fluid moving
right,
and everything,
right.
It just starts smoothing out. So movement is good. Not necessarily movement with weight.
Right.
So like if you're having arthritis of the knees and you go running, you're getting movement, but you're also getting pounding.
Impact, exactly.
So with biking,
right.
you're getting movement and not really much impact. So the arthritis could actually get a little better.
Right, so the activity's got to correspond and be the right activity and the right motion with the joint so that it improves. And of course, if this is an extreme case of arthritis, any movement hurts,
right.
We're not talking about that.
No, yeah, and you're right, Brad. There gets to a point where the arthritis is so bad that any movement just makes it worse, and then you're beyond, I'm sorry, it is that time.
Right.
And I've seen that a lot in shoulders.
Sure.
Where it's just so bad that you hear that, you can actually hear the crepitus.
Right.
That then it's time, then it's time to have a shoulder replacement or injection or whatever they're going to try.
Exactly.
All right, the point that we're going to make here, which we have found to really work in the clinic, is that no matter what joint it is, shoulder, knee, hip, if you can gain a little more of the motion back, a lot of times that helps really decrease the pain.
Right.
Even a slight increase in improvement in motion will help. So like if you're right here with the shoulder and you're able to stretch it out and get it up to here, pain tends to go
Right.
down. So we're going to go joint by joint and show you how to stretch each joint. Let's first start with the shoulder, Brad.
Okay.
A good one to just start with on shoulders. What I like to do is you just find a countertop or a chair, a good steady chair. I'm going to stretch this one out. So what I'm doing while I put my hand on here, I'm pushing down into the chair.
This direction.
Or onto the countertop. And while I'm pushing down, I'm walking away. I'm giving it a bit of a stretch, but a lot of times that sets the shoulder down in the socket.
Why don't you do it the other
Sure.
arm so they can see better? And then I can point with this handy-dandy pointer with the red pointer.
Okay, so I'm pushing down, I'm pushing down, I keep pushing down, I keep pushing down.
See that now he has his shoulder is in the same position as
it's
if
a
you're
sneaky way of getting motion.
Right, but the force he's talking about pushing down takes the joint right here and moves it into the socket a little bit more. So oftentimes that can offer more pain-free range.
Right, because you want to do this pain-free. You don't want it to. I don't want you going ow, 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 ow.
Right.
As soon as you hit pain, you back off and go up the other way again.
Good.
That's with every one of these. You're going to get. You can bump into the pain, but I don't want you going crazy on the pain. Do you want to show extension, Brad? You can show it with that even.
And extension is one thing that I know Mackenzie.
There's a big one on.
And he has a lot of luck with this, and his therapists that he trains do. An extension, you know, this is flexion and this is extension. Not out to the side like this, but it's straight behind you. So you can take a cane or a stick like this. Yep, piece of doweling, PVC pipe. Grab it here, and this hand is going to do the work. This one's going for the ride. Okay. And we're just going to extend it back like this. And you're going to go back as far as if you feel, you know, stretched, then you back off. So pressure on, pressure off. You don't go so far you get into a sharp pain. We don't want that. We want to just get into a stretch, a gentle stretch pain, and keep working that pressure on, pressure off. And if you start out here, and after 10 of these, and probably 10 would be enough at one bout, and you're back, you know, another 20 degrees with no more pain, you're making good progress.
Right. And, you know, with all these, you can do these throughout the day, several times a day. And then eventually, when you get to the point where you need to be, then you can just do it once a day.
Right, maintenance.
So, so we can do shoulder flexion would be the next one, Brad. This one often is better laying down even.
Yeah, I was just going to mention that.
Yeah, you can take a cane again or your broomstick. And what's nice about this, if you have one shoulder that's better than the other, that can help the bad shoulder.
Exactly.
So you can go like this, and you can work it this way, or you can go like this. If I'm going to work this one, I can go like that.
Sure.
And work the bad one.
So this would be
this one's the driver.
Right.
Yep, and it's pressure on, pressure off.
Right.
Pressure on, pressure off. Works really good.
Good. And let's do the other way once. I just want to bring up one point. Now, you can't see it from that angle, but if we tilt it this way, you may want to spread your hands
out even further.
Apart, and that may make a big difference.
Yep.
So you have to experiment with that.
One little cue too, Brad, if it hurts on the way down, if you push against the stick while you're going down, it actually takes away some of the pain.
Oh, sure.
It helps it
that would
set
relate
down.
to the other one.
Yeah. Do you want to show internal rotation with that strap, Brad?
Oh, yeah.
You can do this with a belt. You can do this with this is a stretch out strap.
Okay. So we're going to go from behind, and if you have a belt, actually a leather shiny belt works really good because it slips across your shoulder. You'll see what I mean in just a bit. But we're going to get this motion, and you can see I'm just pulling up and down, pressure on, pressure off. So in the front, this is the way it looks like here. I'm just using this hand, and it slides across your shoulder. That's why if you have something shiny or a smooth belt, it's a little easier, but this will work. It's not a big deal. And it works better if you go on your wrist as opposed to just grabbing it with your fingers. That kind of works, but your arm cannot be as relaxed that way.
All right, let's go to the hip, Brad. You can do hip flexion, real simple, laying down. This is a great one to do when you just wake up in the morning. Go ahead and start, giving pressure on, pressure off, pressure on, pressure off. You can do hip extension. Well, one way you can do it is actually just lay flat on your stomach and push up like this.
Yeah, do a little press up.
Or if I want to get a little fancy, I can go off like the table like this, and I can really work on a hip extension.
All right,
there.
this is for the more,
more
people.
Advanced.
More people are you're mobile and a little more docile, so to speak.
You can also get hip external rotation. I just was telling Brad I had a patient that this really worked well for her. If you cross your legs and you find one leg is up like this and the other leg is down, this one is tight. So you want to go ahead and you can just go ahead, pressure on, pressure off, Pressure on,
And
pressure off.
that's all hip motion right there.
Yep. And this is a great one for increasing motion. Do you want to show the knee extension, Brad? You can
Sure.
Just
Actually, that's why I've got this out.
oh, you got that out. Okay.
Yeah.
You want to do it on the?
I'm going to do it here so we can do it sideways. And it works best if you're up on a stool, or you could be on a chair. But the thing is if you want to get full extension with your knee, and a lot of times with arthritic knees, that'll go, to maybe 5 or 10 degrees. And if you're gonna,
if you have full extension already, you don't need to do this.
Right. Yeah, if it goes all the way out, or you're one of the hyperextenders for sure. But if you go down and you can tell there's a bend there, and the other knee's straight, if it looks like this knee, I'm going to work. Try and relax it and do some pressure on, pressure off. Now, you're not going to go so hard that you get sharp pain.
Right.
It's, making your eyes open.
And the first day, only do it 10 times and then
Yep.
don't do it again because you could get sore. I had a patient who got real sore and upset with me.
Yeah.
Because, well, we went a little crazy.
Yeah,
I mean,
you got to use good judgment. If you go 10 times and by the 10th one, it's totally straight and it feels better, that's a big green light. You're probably going to do well for, on that stretch.
And for knee flexion, you can do that laying down flat too. You can go like this and work on knee flexion this way.
And you get the hip and the knee.
Yep, at the same time.
It's a double header.
Or you can actually go into a chair. Actually, I think I'll use that stool.
Yeah. Bob's taller.
Tall, so you can actually lean forward like this and stretch it that way. That gives a good stretch.
Sure.
So
and you're pulling on that a little bit?
You can pull on it a little bit. I'm not going to show the rotations
Okay.
this time. That's kind of a more advanced one. So.
Okay.
So, remember, Brad, we can fix just about anything.
Yeah, we just fixed arthritic joints, but we're having problems with
a broken heart.
There you go, Bob. But we're working on it.
We're working on it hard.
You better believe it.
Thanks a lot for watching.